which we start, of course, with this. The Western Cape was once the epicenter of the coronavirus in South Africa. Exactly a year on, it's seen over 278,000 cases and 11,243 deaths. While the numbers of deaths and new infections is slowing, the province is not taking any chances while it's gearing up for a third wave. eNCA's Ayesha Ismail joins us to look back at how the Western Cape dealt with the pandemic, but also she'll be joined by Spamantla Koke, who is at the Netcare Pulosho Hospital in Polokwane. Colleagues, good to have you back. But Ayesha, I just want to start with you from where you are, because I know that the Western Cape was one of the epicenters of COVID-19. Last year, we saw that Field Hospital at the Cape Town ICC also being constructed there. I mean, what have health workers been through since that time last year?
So good morning, Tamela. I'm now at the Tygerberg Hospital here in the Western Cape, and this is the hospital that was the main hospital to deal with the COVID-19 response. And having spoken to some of the people involved in setting up the COVID-19 response, and they were telling me about what they had to do, the management that went into it, the dedication, the hard work that went into dealing with the COVID-19 pandemic. But I'm not going to waste any more time. I'm going to go straight to Dr. Maulana to tell me about what it was like being part of this team to set up this COVID-19 response.
Yeah, look, it was a huge thing. About a year ago, I think the first patient that was announced, the first positive patient was here, and by that time we already started preparing for this response, and structures were set up to manage patients, possible influx of patients. And we were watching what's happening in other countries in Europe specifically, and we were trying to prepare ourselves for an influx. And it sort of helped a hell of a lot when the lockdown was announced. Bought us a lot of time to get ready and prepare, and my two colleagues here next to me were instrumental in helping up setting up these structures. In fact, Dr. Parker was busy before then already, because Tygerberg Hospital, I think, was the dedicated hospital for COVID initially, and all the travellers that came in via the airport came in here for tests, and people that thought they had. But our first positive patient, I think, only arrived about by the 15th of March, admission that is, that we had here, and from then slowly trickled up to, I think, by the end of May, then the dam halls burst, and then we were admitting, and I think we admitted up to about 1,000 patients in the first wave. A lot of them in ICU, ICU structures were set up, our ICU was expanded, we had up to 40 beds, and I'd like to think we coped, but it was tough, it was difficult, and we're here now, and we got out of that wave by the, I think, middle of August, sort of slowed down a bit, had a bit of a breather, and then we got slapped again by end of November with the second wave, and that was crazy.
I just want to go to Dr. Parker. We're talking now about when you got through the first wave and then the second wave. And it was during the second wave that we also saw a number of health workers testing positive, being hospitalized, but also, sadly, some of your colleagues died. How did that make you feel?
The second wave for me specifically was very hard. It was much harder than the first wave. In fact, I describe it as fairly brutal. And I'm so grateful to our team of colleagues, not just at Tygerberg, but throughout the province, private and in public hospitals, who actually gave the second wave response the absolute all. So a lot of us were working very long hours, seeing lots of patients. At the same time, our friends and families were also getting admitted to hospital, and for me personally, it was a struggle to find beds for some of my family members while we were on call. So I think I have to take this opportunity to thank our team at Tygerberg and a lot of the hospitals in the province. We viewed our COVID response as a whole of hospital response, and I'm very grateful to our colleagues, especially our junior colleagues that worked very long hours, were exposed to a lot of suffering, death, that, you know, they will have to process for a long time going forward. You know, everybody just sort of, you know, pulled their weight and worked really hard. And then also, you know, the response was largely an internal medicine response, but at the hospital I'm very grateful to our other colleagues outside of the discipline of medicine who stepped out of their comfort zones. So we had, for example, dermatologists and surgeons, you know, working alongside us. You know, surgical ICU specialists working with medical patients, as an example. So I'm very grateful to all our colleagues for assisting in what was a very difficult second wave.
Thank you so much. Now, Dr. Schroeder, the Western Cape's about to exit its second wave, and already health authorities are preparing for a third wave. So there's more work for you, more hard work.
It is. It's been a hard road. It's been a long year, and it's been very, very, very trying. I think it was very easy to lose hope. But as Dr. Parker and Dr. Malana has described, I think the whole health sector, public and private, galvanized together. You know, we were humbled by this virus. We didn't know what to treat patients with. We didn't know what made a difference. We just saw people dying, and we felt hopeless. We felt helpless at the start of this. But as we developed the skills and the knowledge and the techniques of trying to help patients, we gained more confidence, and there was hope. And galvanizing as a team, we built hope. You know, we talk about our young colleagues facing the wave, the tsunami, day after day. We spent a lot of time trying to support them and get them through it. And the third wave, that's going to be key. You know, we are very mindful of trying to get our frontline workers protected, not rehabilitated, but almost let them get their rest and recovery. And we are trying to motivate everybody, but we need everybody's help with the third wave. The public, we keep saying, everybody sees us as the frontline workers, but the frontline is the public. We need the public to be doing what they need to do in terms of their behaviors, their actions in terms of mask wearing, you know, keeping their distances, you know, not attending large crowds. That's going to be key for the third wave. You know, the lockdown brings us relief because we know it slows down the virus spread, but it does have a significant impact on people's livelihoods. And so we hope that the country can go forward obeying the advice, or following the advice of social distancing, mask wearing, hand sanitizers, that we don't need to have lockdowns to control the virus spread. That's going to be key. The third wave is going to be hard because we all feel pretty spent at this moment. But you know, there's still this commitment from the healthcare workers across the world, across the country, that we want to get it through, because we have to give hope. We have to give hope to the world.
Thank you so much for your time, Dr. Schroeder. Wow, just getting goosebumps just listening to these doctors talking about the hard work that they've put into all these months to try and save lives, and also still appealing to the general public to also play their part, and also hearing the doctors saying that the third wave is going to be hard.
Well, thank you so much, Ayesha Ismail. We'll leave it there, but of course